Bipolar disorder is a mental health disorder that involves drastic shifts and changes in mood, activity level, and thought process. So there are different types of bipolar disorder, all of which involve drastic shifts in mood, and they're on a spectrum. So it's important that a person get a full mental health evaluation as early as possible so that they can get diagnosed with the most accurate type of bipolar disorder. So some of the signs and symptoms of bipolar disorder are extreme and drastic mood changes. So if someone is got an increased amount of energy, is not getting very much sleep, and does not appear to have a decrease in energy because of lack of sleep, or high impulsivities, engaging in risky behaviors that is not typical of them, and then suddenly, flatlining to a depression where there's an extreme low, feelings of guilt, feelings of worthlessness, sometimes feelings of suicide that cycle back and forth. Those are the signs and symptoms of bipolar disorder. For family members and loved ones with someone suffering with a bipolar disorder, it can be challenging, it can be scary. Someone experiencing a manic episode can sometimes be referred to as crazy, but the truth is this is a highly treatable disorder that is very responsive to medications and therapy. Psychotherapy involves counseling, so that can be counseling that helps with the development of positive coping skills, that helps reduce stressors from triggers of everyday life, such as job-related stressors, family stressors, that can trigger sometimes, an increase in stress and an increase in the potential for a relapse. The Tallahassee Memorial Behavioral Health Center and the Apalachee Center are both great resources for people who are maybe needing an initial mental health evaluation on an outpatient basis, or who are in acute crisis and may need an inpatient hospitalizations. It's great to work in a community where you have two organizations that have partnered together for the provision of mental health care, because essentially there is no wrong door for a patient to be at.